Good evening, good afternoon, everyone. Welcome to the AAPD Town Hall. This is our second town hall in response to the COVID-19 crisis. We're going to get you up to date as we are today. We will introduce our panel as last time, our experts and our leaders from the APD, after which we'll get right to your questions. You sent many questions in. They're quite collated well into categories, so we will answer them categorically and try to answer as many of the subject matter as possible. This is a point in time, as our speakers will discuss, where we will continue to be up to date with the latest information for you, for our members, and for others practicing pediatric dentists. I want to call your attention to the annual session that the Nashville virtual, that will take place May 21st to 24th. The first day of that virtual session is a pre-conference course dedicated to what we call turning the lights back on. And although we're talking about that today, and we'll continue to talk about it in the website, we'll have the latest information all the time. We believe by the 21st, as many states emerge into opening their practices, and beyond that point, we'll have a lot more information, even though that's only 3 weeks away. So we've planned a course given to you that will talk about everything you need to know, we believe, to get going in your practice. And I'm just going to briefly show you what the content of that course will contain. So you see before you now, we have 6 topics, 6 great speakers, and they are peer-to-peer. In fact, I'm really happy that Ron Shu, a private practitioner owner in Washington State, who was one of the earliest to respond to the COVID crisis, has agreed to co-chair this session, and we'll be introducing our speakers. We have a great lineup, which we'll be announcing next week, and I urge you to take a look at the entire annual session, in particular the pre-con course. So we're going to talk about what's transpired from December 31st last year and right up until May 21st. Then we're going to have a speaker talk about what I call Virology 101. What is a virus? What are the different terminologies? What is a particle? What is a aerosol? We'll learn everything about the science of virology important to the clinician. And then we'll get right down to the nuts and bolts of infection control. We have an expert who is in touch with the latest recommendations as of that date, who will talk to us about exactly what we all need to do for different procedures in terms of infection control. Then we will talk about in the afternoon sessions, how to communicate, everything about communication, expectations for the parents, how to interact with everybody around the practice, including promoting all the enhanced safety measures we're deploying. Then we will put it all together. We will have an expert talk about workflow, and it'll be a peer-to-peer, practice owner talking to you about how we take all the information we've learned, put it into a workflow, and make it work in your practice. The purpose of this course is to educate all of us with all that we know to make it as easy as possible to reemerge and be successful in our practices. And then finally, we'll talk about the outlook for pediatric dentistry for the rest of the year, beyond the economic outlook, and also what we believe will be a very strong place going forward. So I urge you to take a look at that, as you'll see the information coming out, and we'll talk more about that next week. So I want to get to our panel. First, I will introduce Dr. Kevin Donnelly, AAPD President, and he will introduce the other panelists that you see before you. Kevin, I want to make sure, as you make some opening comments, that you also talk about the media tour that I understand you're going to be engaged in, that's going to reach millions of consumers later this week. Thank you, Kevin.
Well, thank you, Joel. Welcome, everybody. Good evening to you on the East Coast, and I guess good afternoon to everybody else. Welcome to our second town hall. Well, I guess we're all going to be opening relatively soon. It'll vary a little bit depending on where you're at in the country, what the level of disease is in your area of the country. For instance, here in Texas, we have some areas in West Texas that has no disease whatsoever. And then, of course, we have Houston that ranks, in the top 5 in the country. So anyway, it's going to vary from place to place, but we wanted to have a town hall to talk about reopening your practice and being ready. Thanks, Joel, for bringing up the media tour. This Thursday morning, starting at 6 a.m. Central Standard Time, I'll be doing a virtual satellite media tour. We expect to have 36 outlets that we will interview with, which will reach tens of millions of viewers across this country. And I think the key of this tour is going to be to talk about, number one, the medical necessity of children to see a dentist. As we all know, oral health is critical to overall health. And so that will be a big portion of my tour to convince people of that. And second fold, I will make absolutely sure that people are comfortable that we are following the latest possible guidelines for safety, not just for their children and for families, but for our very staff that we love and for ourselves to make sure that we are doing this in the absolute safest manner possible. I think that's going to be critical as we move forward. And I think it's really critical that we note we are really a special breed of dentist. We're not just your typical dentist because we see kids. They're at high risk. We know that 75% of our membership sees Medicaid. Absolutely critical that we treat those kids because we know they're at the highest risk typically. And so we really need to make sure we get these kids in, particularly for the ones that didn't need emergency care, but they need urgent care, and then go on to what we're best at prevention to keep these kids out of emergency rooms so that they don't have to sit next to an adult that's coughing and overburden the system. So that's just kind of what I'm excited about to do on Thursday morning. I want to save as much time as possible tonight for some questions. So I'm going to introduce our president-elect, Dr. Jessica Lee, that'll make a few comments now.
Great. Thank you, Kevin. Good evening, everybody. We are back. 2 weeks ago, we had our first town hall, and we made a promise to communicate with you more often. So we're here to do that tonight. 2 weeks ago, we heard from you that the Paycheck Protection Program was out of funding, but now it's been funded for $400 million more. 2 weeks ago, we had almost all states that had strict stay-at-home orders. But now we see dental offices that are opening across the US, and we'll see more every day. So much has occurred in 2 weeks, and so much will occur in 2 weeks more. During this town hall, we will emphasize the work of the safety committee and the practical guidance based on the best evidence that's out there. And trust me, we have to actually focus on the best evidence. We don't have the science that we want. We have the science that's out there, and we will provide the best guidelines we can. While we dive into those details tonight, let's try to put this in context. While we will continue to work with the CDC, ADA, OSHA, and we had a meeting with the CDC on Friday, so we'll continue to work with those groups and provide you with all the information that you might need to be best informed. There's only one person that can make that decision. There's only one person who's the expert on whether or not you open your offices, and that's you. Yes, we can advocate, we can provide best science, provide guidance, but you are the leader of your team, and they're looking to you. During the last town hall, I made reference to the sacrifices that you've all made and the trauma that we've all endured with this pandemic. And now we are all being asked, you're being asked to find the courage to make some very, very difficult decisions, not just about your practices, but about the safety and well-being of your staff and your family. That is a tremendous burden to carry. So it's our role, it's the role of the AAPD to provide you with the best science, to guide you, to lead you, and to be on this journey with you. We will be there every step of the way. I'm going to hand it off to Paul Casamassimo, who's going to talk a little bit more about the work of the safety committee. Thank you.
Hi, everyone. I hope you can hear me. Good evening. I hope everybody's staying healthy. The virus has affected us. If you watch the news, you get stories. I can share one with you. My son-in-law is a firefighter in New York City, and he got the virus and spent 2 weeks locked in his bedroom. Couldn't see his family, had his food passed under the table, or excuse me, under the door. And he finally went 3 days without fever. And so his email to us was, I finally got to hug my family. So it all turned out well. But for those of you who have family members, our sympathies go out to you. And please stay safe and healthy. So I'm going to talk a little bit globally. We have Jade Miller is going to talk a little bit more specifically about some things. There's been a lot going on besides preparing a guideline, and I think maybe Kevin will talk a little bit about that. It'll be out tonight and tomorrow, and give some advice as much as we know about what you should be doing to get your practices ready. States are already rolling it out. Ohio starts May 1st. Other states have already opened up again for dental practice. So it's very timely. You all should be aware the ADA has put out guidance, a toolkit. So if you can access that, that has information. And I would start and make the point that this is new territory for all of us. The evolution of this disease, how we mitigate it from country to country. You probably know Sweden has taken a position of developing herd immunity, and they have not closed anything down. In some of the Asian countries, dental practices went on as they did before, seemingly without problem. So we're really making this up as we go along and trying to put safety first, and then getting our practices back. And as I like to tell our state dental board, you can't have a healthy patient population unless you have a healthy practice system. So we've got to get back. We've got to get back, and we will. So at the greater level, AAPD is working with CDC and with, excuse me, CMS. We have regular calls. We just spoke with the CDC and talked to them about our emerging plan for office opening, and we'll continue to have recurrent discussions with them to not overdo a response, but to use data, and they have the data, to look at how things are happening as practices open state to state and make good decisions that benefit everyone, keep people safe, and also allow us to get back to taking care of kids' oral health. So that's the first thing. The second thing is we've talked to CMS. We do it on a regular basis. There are some things that are going to happen in Medicaid that go well beyond the concern that many of you listening to this have about increased PPE and the need to be compensated for it. Almost every state will take a tremendous budget hit. And so you will see things happen in the Medicaid system. We don't even know what those will be. They can be, in some cases, reduction in reimbursement or delay in reimbursement. And it could be paradoxically a state trying to keep its Medicaid providers in by actually increasing fees. And I know someone will throw that back at me if it doesn't happen, but that's what we're talking about in Ohio. So there are a lot of things going on. We're trying to deal with a huge problem that is exacerbated by this, and that is operating room cases. And I know everyone on this call has probably been stacking up kids who really need to be taken care of. And it's difficult enough in almost every state to get operating room time just for in the regular situation. And now with this virus, the requirements to get a kid into the operating room are very stringent. And then in a very short period of time, we'll be competing with the medical surgeons trying to get available OR time because they have the same situation. So we're looking at that, I intervened. I had a phone call today with a Michigan hospital director, Children's Hospital. He was trying to get advice how to take care of kids and have the pediatric dentist be able to do that. So we have a lot of those kinds of things going on through the Policy Center. And I hope that all of you will let us know the things that are happening in your area and keep us apprised of changes that are going on in the Medicaid system, because that will definitely, that we will see effects of this pandemic. I just want to talk a little bit about advice about getting your practices started. And I mentioned that this is everyone's best guess. And so if you have guidance from your local state on what to do, or your state dental association, I know Ohio just issued, the ODA just issued some guidance that goes through things like PPE and keeping spaces between patients, and methods of sterilizing and cleaning offices. If your state is opening, look to your association for that kind of information. Look to the CDC for that kind of information. There is no magic bullet. Everybody's practice is different. You see different types of patients. You have different size practices. You practice at a different rate. So it's very difficult to say this is exactly what you should be doing. And so it's not that we don't want to. We'd love to be able to say, do it this way, but we don't have the data to say this is the way to do it. And everybody's situation is different. So you'll see this come out in our checklist, things that you should consider and try to relate to your own practice circumstance. So I think that's all I have to say right now. So Joel, are you ready?
Jade, did you want to make any opening comments?
Yeah, I would. And let me know if, I don't know if Paul's video was a little bit jumpy or it's just my reception, but Joel, are you able to hear me okay?
Yeah, we can hear your video is a little jumpy, but go ahead and keep talking, please. Yeah.
Okay. All righty. So as has been mentioned, tomorrow we're anticipating the AAPD to be getting out a re-emergency in pediatric dentistry practice checklist. So I know that's really what dentists and our members are looking for. Hey, give me a checklist, give me some resources so I can reopen my practice. As many of you saw yesterday, the ADA came out with Return to Work Interim Guidance Toolkit. So I think both those resources, the ADA's Guidance Toolkit and what you're going to be getting tomorrow via email, the practice checklist, are two great resources. Now they're not identical in that the ADA is more prescriptive and goes step by step, and the AAPD tends to be a bit more comprehensive with more resources and more things to consider. So I think they're going to work well together for our practitioners. So just some general ideas about reopening your practice. I think first and foremost, communicate with your staff and patient families. They are likely very concerned about their safety. So, through your phone messages, your website, have scripts for staff. You need to reassure them that you're taking steps for their safety, and safety is your #1 priority. As Paul just mentioned, the prevalence of this disease varies from region to region, community to community. So you're going to want to obviously work with your dental board and your state your state health departments as you really navigate, are there specific requirements specific to your region? As has been mentioned on the last webinar, work with supply chain to get good source of PPEs, gowns, decide whether you're going to use disposable versus laundered, surgical mask, N95 mask. Also, will you need to have them fitted? You can go, and at least for me, I went to the hospital I am affiliated with for fitting and certification. Also, there are resources in the checklist that talk about decontamination of your face mask, and OSHA's provided, or CDC's provided information related to that. And understand that dentistry really is in the high risk category per the CDC. We would, in many cases, I think you're going to want to consider really just starting slowly and reassessing in 2-week intervals. Limit the length of your appointments, but maximize the treatment that you can perform. And really, when you're performing care, you want to sit down with that patient, get it all done, and then have them get ready to be discharged. We're out of the days really of going from one patient for a hygiene check to a restorative patient. Those days, at least in the foreseeable future, are going to be changing. Also, engineering controls. Evaluate ways to help mitigate aerosols. Rubber dam, HVE. There's good resources in this AAPD checklist that really show how effective rubber dam and HVE suction can be. Also, it's important where you place that high volume suction. So you have to really be able to capture the aerosol and the splatter and the droplets. If you have the capability, consider a second HVE. There's some innovative ideas with almost like a funnel-shaped system that you can capture some additional aerosol. I know there's been some question related to the elephant trunk type of extraoral suction that has the HEPA filters as well as the UVs. I mean, that's something you may want to look at, but we're certainly not saying that you need to go down that road at this point. Some other areas are assess ways to improve the air quality in your higher risk areas of your office. In this guide, the checklist, there'll be resources from a variety of different national organizations on HVAC type of engineers that really discuss things to consider in aerosol control. Also, as Jessica mentioned last time, there's a difference between droplet, which is greater than 5 micrometers, and they tend to fall around 6 feet within the vicinity, where the aerosols, which is under that 5 micrometers, tend to be more suspended and last for a long time. I know there, at least from my understanding, there's still a question how much are aerosols involved in transmission of disease. But I think until we have verification or confirmation that it's a low risk, we need to assume that that's a high risk and viral contents will be present. You need to also identify priority patients, triage who's the highest priority to get them in for care. You need to allow more time for your patients to go through the screening. It's just going to take more time. So you're going to allow more time for that. You're also going to be doing a pre-appointment screening in advance, where you're going to evaluate the patient and also the person bringing in that patient if they're a guardian. You may be doing that by phone, by email. You may have a form on your secure website. You want to remind them to limit really only the one guardian coming in and try to prevent other family members from coming in. At that time, on the phone, when you're communicating with them before that appointment, you may instruct them to wait in the car. There'll be text to come in to the office. And also you may want to have them wear face coverings to bring theirs from home already. Once they get in the office, you're going to have in-office screening and questions. You're going to screen all the individuals that are going to be entering the office. They're going to need face coverings, hand sanitizer, temperature checks. Are you going to limit how many in the reception room? Are you going to have 6 feet distancing? Are you going to disinfect those areas that they occupied after the patients? Eliminate toys, magazines, anything unnecessary in the waiting room. Then there's the whole question about testing, viral testing, antibody testing. When's that going to be available? Where do you refer potential patients? You're going to need to consider that are potentially symptomatic. Then also, how are you going to plan to manage those COVID positive patients that need urgent or emergent care? Our staff has concerns for their safety. So you're going to want to really look at, in the business or reception area, what type of protection or barriers you may want to have there. Are they going to wear masks? Also, your daily screening of staff, temperatures, and a log of that. You also may want to consider having staff leave their scrubs and shoes in the office so that they're not transferring things back and forth to their homes. Schedule modifications. You may want to consider aerosol versus non-aerosol days. A higher risk patients scheduled differently, perhaps at the end of the day, or have specific days for those. The clinical area, you're going to want to remove what equipment and supplies that are exposed that you don't need in the operatory or that treatment room, because you're going to either need to consider burying those or surface disinfecting those. Cover your computer keyboards, some way to bury those as well. As it comes to restorative or operative type procedures or hygiene procedures, are you going to consider a procedure mouth rinse. In if your configuration of your office design is in more of a Bay Area, or you can consider social distancing, so maybe alternating chairs. Are you going to provide some of a barrier? Maybe it's a temporary curtain between chairs. What are you going to do hygiene-wise? And your state regs may really dictate this, but are you going to initially begin with toothbrush prophies? Are the staffs going to be, will they be in a situation they'll need to have like N95 type of mask? What's your aerosol management? How can you reduce that with HVEs in those hygiene areas? The restorative, consider phasing it in. Aerosol treatment versus non-aerosol treatment. Do you have an enclosed room? Can you temporarily help control the aerosol? And then there's air quality management with rubber dams, HVEs, as I mentioned. The other area that was brought up was those patients that require more attention. For example, patient management, behavior management patients, medically compromised, immune compromised patients. Are you going to delay their care? Are you going to need to go to the operating room? Is there a hospital-based clinic that you can refer them to? Will you treat them at the end of the day or on specific days? One other area is nitrous oxide and infection control. You're going to do something disposable, sterilizable, an innovative idea that may want to consider as we've all worked in the operating room on the anesthesia cart, we've seen the little filter as it comes off the anesthesia machine, which in many cases are a bacterial viral filter. Is this something that we may incorporate in our nitrous oxide system? And then lastly is patient tracing. You're going to need to keep an accurate log and schedule the patients with the schedule of the patients and staff, because if there is an incident where there's a positive patient that has had interaction with staff or patients, you're going to really need to do some post-appointment tracing. And so you're going to want to try to keep pretty tight control and track of who's in the office at that time, keep those social distancing. Also, you may want to consider have one staff person maybe stay only in that column that they're not moving around a lot. Again, it's all about help controlling the environment. So I'm going to turn it back over to you, Joel, for questions, but hopefully those are just some topics. You're going to find more of that tomorrow when you get the practice checklist from the AAPD, and utilize that with the ADA's work interim guidance toolkit. Thank you.
Thank you very much, Jade. Thanks to the panelists. As I mentioned, you've sent in hundreds of questions. There are essentially very few categories. And the number one question was about PPE, and I'm going to go in a minute to Dr. Donnelly, but I wanted to reassure everyone that every question you asked us, many of them were answered already in the comments, but we will continue to, as we move forward, to get updated information, and all of those questions will be answered. And in particular, for the pre-conference course I mentioned earlier, the speakers will be given all of your questions in advance to make sure in the respective topics that everything gets covered. So Dr. Donnelly, Kevin, PPE was the number one category of question, and specifically N95 masks. So can you comment just briefly, because there's more to learn about the availability of PPE and specifically N95, and when maybe do you not need them? And then there were questions around, can you sterilize them? So let's just hone in on the PPE and maybe gowns and N95s.
Well, yeah, as I read through all the questions, a majority actually revolved around PPE and exactly some of the things that you brought up, Joel. To start with, I don't think anybody's going to be surprised when I say there's a shortage of PPE, and especially the N95 masks. I know we've been trying to get them. I encourage you to continue to try to get those. The reason it's so difficult is not just because of the numbers that are out there, it's because our government basically controls this right now. And the reason they control it is they need to get these masks to the front runners who are really taking care of the active coronavirus victims. And it's not that dentistry should take a second seat, but we are not seeing quite as many active folks. And that's why we're trying to treat emergencies, on an outpatient basis to keep them out of those emergency rooms. where we have a lot of active coronavirus patients. What I want you to know is the AAPD is not sitting back. We are aggressively talking with industry on trying to obtain N95 masks and PPE. I think that they are very receptive to us. I think the things that we really stress are, number one, we don't want these kids to go to the emergency room. You know, we want these kids to come and see us, and we want to take care of their urgent needs before it becomes an emergency need and they may have to go to an emergency room. And boy, that's pretty easy to convince people. Number two, as I brought up earlier, we see all those special needs patients. And so we certainly don't want these compromised kids to be in an emergency room ever. And we want a great prevention plan on them. And that is excellent and well understood by industry. And the other thing is, I mean, we are really taking care of the very poor. As I said in my opening, we basically take care of Medicaid. And those are the kids that are most vulnerable. And don't think that the CDC and every industry out there does not know that. And so I do believe we will be a front runner when it becomes available. I can tell you here in Texas, it automatically goes to the chief of surgery, and they distribute masks. We get some for emergency care, including N95 masks. We don't get a lot of them. We get exactly what we need, no more. We sterilize them. To be able to use these masks more than once, the first thing we do is we wear a surgical mask over the N95 mask. And so we're able to use them up to 5 times, which is good. We can send them then in for sterilization and be able to use them more. And if we're doing any type of procedure that might create an aerosol, we also wear a face shield to try to protect those N95 masks because they're so scarce right now. I talked with some folks from 3M. They are working around the clock on making these N95 masks. They've closed down one division to only make N95 masks. They are convinced that the market will be flooded, but I'm afraid to tell you it might take a good month. So, you know, I think we're going to have to be patient. Medicine's going to have first priority, but I truly believe pediatric dentistry and oral maxillofacial surgery will be the next two that will receive these masks, and PPE, because we are seeing such special populations. The other thing that I saw a lot of was, well, do you have to wear an N95 mask to do a prophy? Well, guys, I hate to tell you this, but you create an aerosol when you do a prophy. And so I think you have to go back and you look at risk factors. And if this kid hasn't been out of the country and their family hasn't been out of the country, nobody in the family is running a fever, you're probably at a low risk with that child. However, they could be a carrier and you don't know. And so if you're creating an aerosol, the best thing you can do is wear an N95 mask. Most likely a surgical mask will be adequate. And if you look at the CDC guidelines, that's precisely what they say. That'll give you moderate protection if an aerosol is created. But if there's no aerosol, certainly I think a surgical mask would work. What I kind of like to think is maybe we can actually go back to something that's so valuable that I miss, is the toothbrush prophy. And of course you can create an aerosol, but if you're careful about it, not nearly the aerosol you can create with a handpiece. And you know, we have known for years that a prophy does not prevent caries twice a year. Fluoride sure helps, but prophies don't. And what a great opportunity for us to go back to the basics, disclose a kid, show the parents where this kid cannot brush well, where they're missing, and really go through oral hygiene, because that's probably the best they can do during this time when it's more difficult to get into the dentist. And great home care is the answer. So maybe we'll see some of that occur also.
Thanks, Dr. Donnelly. I'm going to go to Dr. Casamassimo for some follow-up based on the introductory comments. Paul, the work of the Policy Center, you're being the Chief Policy Officer, is fed by ADA guidelines, CDC. There were quite a few questions regarding the conflicting guidelines, and I think a couple of panelists alluded to that. potentially conflicting. You know, if you have a state entity that says do it this way, but the CDC says no, wait on that. Who's the authority there, and how does like when you think of the toolkit that's going to get released, which is great, we're going to keep getting more and more information. How do you make those kind of decisions from the policy center perspective? You're muted, Paul. Can you please unmute? Yeah.
My wife would prefer it if I was muted, but not everybody on this. So that's a great question, because I had some discussion with a dentist in a Western state who had no restrictions in his state. And he had a tremendous ethical dilemma, because his professional organizations were telling him, don't do this, only see emergencies. And he was saying the government says it's okay. So the bottom line is, if your state tells you to do it this way, your government, your public health authorities, that is what you do. And, you know, because every state is different, I can't give you any more information except to say, look to that for guidance and use that to direct what you do. The other thing I wanted to talk a little bit about, and Jade talked a little bit about behavior management. You know, we have some unique challenges. We get that little 3-year-old in the chair who's spitting, crying, coughing, maybe, you know, having other bodily fluid issues, if you want to call it that way. You know, this is all new territory. The ADA is not talking about that in their guidelines. We've really got to figure that stuff out. And there really is no answer. If you can identify, or if you have a child who you know you've seen before and is going to give some behavioral, need some behavioral management physically, you need to prepare for that. You need to protect your staff. You need to protect, you know, that child as well. So, but this is all new territory. A lot of us take care of adult special needs patients. And if you follow the news, you know, nursing homes are the center of infection, and group homes are probably not far behind. And we know that many of our special needs adults may be temporarily or even permanently living or residing in nursing homes. So it behooves us to check before we schedule that patient to come back in, to find out what the status is and to be prepared to manage that. Another group of patients are our in-office general anesthesia cases. And with our checklist, you're going to have a link to the guidelines of the American Society of Dental Anesthesiologists. And they have put together a very nice document to prepare you to resume that within your practices. So look for that when you get our checklist, because it'll help you plan and work with your dental anesthesiologist. And then the last group of patients I wanted to talk about are those that we take care of who have pretty significant childhood illnesses, leukemia, heart disease, and those kinds of things. And can't say it enough or more strongly, talk to their physician. Make sure that you're all on the same page about seeing that child and what you need to do. I'll turn it back to Joel and make one last comment. And that is, we talked a little bit about operating room cases. Every hospital is different. Every hospital has different requirements for testing, PPE, as Kevin has mentioned. There's so many different things that are that come into play. Check with your hospital and your medical staff and operating room staff before you begin to reopen your practice and try to see those patients. Okay, thanks.
Thanks, Paul. I'm going to go to another category briefly to Dr. Miller, and then we'll close with Dr. Lee. I wanted to reemphasize that every question you ask will be answered. Things are evolving. We want you to keep asking those questions. There's some amazing ones that were just asked tonight that we're not going to have time to specifically answer, regarding payments and how should we make payments. You're going to get a lot of information about that. Please know that. Please know that every question will be answered. So Dr. Miller, I want to talk about another category that just you can briefly touch on, and this is going to evolve, has to do with testing us. What if one of the dental assistants calls you in the morning and says, I have a fever? If you can, I know it's complicated, but just briefly tell us, what do we do? And then should we have a routine testing for all of us?
Thank you, Joel. Yeah, first of all, I'm going to steer you to two really good resources. One, the ADA has that really talks about what you do in a situation where an employee or yourself test positive. And also the CDC has a good one just related to healthcare workers. But basically, once the diagnosis is confirmed, then you're going to want to follow medical recommendations, including quarantine for 14 days, determine who the individual came in contact with, certainly notify your staff, ask with how long your staff was in contact with them of that positive individual, the date it was, how long the contact was, approximate distance, are they experiencing any symptoms, and also to let you know if their symptoms change. Then conduct a risk assessment to the exposed individual to really then determine if do they need to seek testing, and this is to your healthcare work, the other healthcare workers around them. Do they need to seek testing? Are there any work restrictions for them if they are suspicious of maybe being have contracted that illness? Unaffected staff, you need to determine whether you're going to seek testing for them. You will always want to keep your staff informed of the results of the test of that positive patient, what their symptoms are, if they're being hospitalized, when they're improving, just to keep them on track. And then it comes back to patient tracing and also alerting patients that may have been in contact with them. So again, this is where it's going to be important to have a pretty tight control of who's around at that time, who is present in the office then. Thank you.
Thanks, Jade. And keep the questions coming. We're going to get them answered, not necessarily today. The opening comments by everybody were addressing questions that came in, and the hundreds of questions. So the responses were based on questions. So many of them were answered already. We're just going to keep going as we go forward. Dr. Lee, there were a lot of questions on those things that we can do that perhaps don't generate an aerosol. Dr. Donnelly was talking a little bit about that. Can you talk to us about some of the things that are really important that we can do easier without aerosols, perhaps, or that are so-called minimally invasive?
Sure. I'd be happy to. I do want to address one question that's been coming in repeatedly on the chat, and that is, how long does an aerosol linger in your area or your room? The CDC has actually got a nice table on its website, and it talks about airflow. And depending on the airflow of your area, it could take, if there's measurements from 10 to 15, 2 to 15. So if your airflow in your area is a 10, it takes literally 28 minutes to clear the air in that area. If it's a 2, it's going to take 3 hours. And so I would highly advise everyone to understand what their airflow is in their area and look at that table on the CDC website. It's very, very helpful to understand when that air might clear. And secondly, another question that kept coming in is the fit testing for the N95 mask. There's actually also instructions for user seal test. That means self-testing whether or not that N95 mask is sealed. So you're able to get that information. I think it's on the CDC website, but I haven't double checked. But they have loosened the guidance on fit testing for the N95 masks. You can actually do a user seal check. So those are 2 repeated questions I kept seeing, so I wanted to make sure those got answered. The things that we can do, dentistry is beyond a handpiece. We can do it. We have, I think the most important thing we do in a recare appointment is the exam and the fluoride. Those are things that, anticipatory guidance that generate no aerosols. I think that is something that we want to focus on, and as people said on this panel, get back to the basics. So that is prevention. We can up our prevention, and one would say that we have to up it more so now than ever before, because we're seeing these kids that are ending up in the emergency rooms now, are ending up getting teeth extracted now. The second is what we would call, public healthers would call secondary prevention, is managing the disease they have, keep it from progressing. So with the advent of silver diamond fluoride, we actually can manage the progression of that disease. Sometimes till the tooth exfoliates, or sometimes, until we can do something else that can be more permanent. Maybe we can cover it with a glass ionomer or do an interim restorative technique. Those things all work. Again, producing no aerosols. You do not need to pick up that air water syringe to do any of these techniques. You can dry, cotton roll, gauze, all those things, you can still do those techniques. And then thirdly, if a tooth is so far, the caries lesion so far progressed that needs to be restored, please consider the Hall technique. There are randomized controlled trials now that are coming out that say the Hall technique used in a specific way with a good diagnosis, going back to your basics, does work. And so those are things you can do. And there is a paper that's been posted. I know it's been distributed to some of the public policy advocates and to the public health listserv, and it's posted on the North Carolina Oral Health Collaborative. There's a paper that's been done by Tim Wright and the faculty at the University of North Carolina, and it's based on the AAPD guidelines. So it makes a lot of reference to the guidelines, but just puts it in one place as a resource for things you can do. So there are lots of things you can do when you open up your dental office without generating an aerosol.
Thanks, Dr. Lee. And it was pointed out during your comments that I'm reminded that not only in the pre-con courses, there are a lot of information related to what has been said today, but there are courses already scheduled. So Dr. Crystal and Dr. McLean and others are doing special lectures during the annual session. I urge everybody to attend that. You're going to get a lot of very specific information about how to do these less invasive procedures, if you will, that are, and I think we all know, and we address this, is just as we're determining how to reemerge into practice from a safety perspective, from an infection control perspective, and that's going to evolve as we learn, because we know very little compared to what we're going to learn about the disease itself. We're also going to therefore commensurately emerge into other procedures as we get a handle on the safety aspect. So we're talking about what to do initially. That's going to evolve, and then over time it'll be sort of the new normal that's been discussed. Is that a fair way of saying it?
I think it is. I also I want to make one more comment about dentist infection control. I think we do this better than any other profession.
Agreed.
So I got to believe that, yes, we're going to have to up our game a little bit. We're going to have to do other things. But if you've been to a medical office lately, dentists do it better. And we are, we own this area. So I think that don't doubt yourself and the precautions that we take. Yes, we're going to have to take some more. And yes, there are going to be things that we might have to do, like social distance. And, I think that absolutely helps with the aerosols and how far they can travel. I also think the airflow in the area, I don't think it's got to be 3 hours. Most surgical centers, it's 28 minutes before that air clears. So I think the 3 hours is a very conservative estimate. But we own the infection control area. We may not be able to have access to some of the things we might want. We will get it eventually, but we do it better than any other profession. And we have to be able to walk in with a little bit of confidence that we have a little bit of control over that. We do it well. The procedures may be modified. I think we can do a lot of things without generating an aerosol. And you got to understand that the oral cavity does not generate as much, doesn't have the viral load that the nasal pharyngeal pharynx does.
Right.
When testing is done, and I don't want to get into all the details of it, there really is, yes, we generate aerosol. Yes, it's a high-risk procedure, and all those things we want to be very careful. But when you look at the actual tests for COVID-19 or SARS-CoV-2, when they take the sample from the mouth versus the nasal pharynx, there's a 56% specificity in the mouth. There's a 98% in the pharynx. So we want to take these precautions, but I also think let's put this all in context too.
Yes. Yeah, and there were a lot of questions about everything you just said, Jessica. In particular, the transition between patients, that's sort of the general category, everything about that. Those questions are all going to get answered as the information comes in. There's a whole host of questions related to that. And another category that we're going to answer as well is, what do we learn from others? I'm following closely what's going on in other countries that have emerged before we did, or maybe didn't stop practicing, as Dr. Casamassimo said. So we're going to learn a lot from what Taiwan did, what Korea did. And as we've discovered, the health minister of Taiwan is a dentist who ran the COVID response in Taiwan. So we have access, and I was informed by Dr. Xu, that we have access to a lot of great information from many other countries that we can learn from, who've emerged from this before we have. And we will get these questions answered, and we'll be stronger than ever because that's what pediatric dentists are. I'm going to call it an end here. You know, we answered a bulk of the categories of questions, and I want, again, everybody to know that we're going to answer every question. This serves as very good guidance to further responses, to further statements by us, and also to make sure we answer every question. And also for our speakers at the annual session, who will be up to date on the very latest information as of that day. And that'll be in part based on the questions you're asking us. So thank you to the panelists. Thank you to our audience. We'll continue to stay in touch with you. And Dr. Donnelly, do you want to make a closing remark, and then we'll end this town hall?
Well, thank you, Joel, for moderating this. Thank you all for participating. I want you to know the AAPD is working really hard for you. And when you look at your checklist that we have for your practice safety, I think you're going to be quite impressed. Saw a lot of things going through here on ventilation, things like that. They will be answered, and all you have to do is click on the link. So I think you'll be happy when you see it, and I thank you all.
Good night, everyone. Take care of
Good night.
yourselves, your families.
safe.
Bye-bye.